So right through here, you pretty much fell right onto this direction.
Mm-hmm.
Okay, you still have a bruise back there. I screened out a lot of your lower back pain mechanically. There's not much of that.
Okay.
So congratulations, this is not a lower back issue.
Okay.
Which I think you knew that coming in here, but I think the lower back is starting to get affected because of the massive amount of dysfunction.
Yeah.
And I think you're starting to lose some strength, not only within the core because of inactivity, but also because of the hip. Because when you bend the hip, you have to stretch the backside. So just like we kind of do a bicep curl, if we do a bicep curl here, you have to curl here, but you have to stretch the backside.
Mm-hmm.
So if you curl here, you have to stretch the backside there, and you're starting to get that pain
Mm-hmm.
because you have to get that stretch through here.
Yeah.
You are 100% shifting this direction away from that pain. The reason you do that, in my opinion, is because when you kind of do this, you're kind of creating a natural slack within that like pelvis
Okay.
and within these ligaments. Every single thing I did with you in terms of muscular was actually fairly normal.
Okay.
What wasn't as normal was the ligamentous tension. What the heck does that mean? It's like when I kind of did this type of movement for you, when I did all the stuff for you, you actually had some pain too. Which makes sense because that's the deepest level. So if I make you do the work itself, typically the muscles take over. But when I do the work for you, the muscles are kind of out of the thing, and then that can help screen out, is it more muscular or is it more ligamentous?
Right.
You're definitely having a ligamentous thing going
Okay.
on. I mean, there's no way you're not
Okay.
at
Yeah.
this point. The problem is sacral stress injuries are lingering. I didn't need to tell you that.
Mm-hmm.
They're pain in the butt, literally. You probably need to sit on a donut or sweatshirts when you're at restaurants and out to eat and stuff like that. And it may be like that for quite some time. I don't know.
Oh,
I don't know.
okay.
I did test a lot, like the hamstring. So here's the glute max that they were probably working on. I'm not opposed to working the glute max or the glute medius or even the piriformis muscles for you, but I don't think a lot of people have paid a little bit more attention to some of these smaller little muscles like the gemelli and the obturator internus and all these other muscles that affect and attach and have fascial attachments to these ligaments, including the sacrotuberous ligament. So if we look at the sacrotuberous ligament, let's get rid of some of these other muscles here. It has direct ties into the sacrum, of course, and the hamstring, which caused some issues through you too, right? Because if here's the hamstring attachments, they attach right through here, and then they also attach to the dorsal sacral ligaments, which are these ligaments back here. I don't think a lot of people have worked any of those. I think that's what needs to be worked on.
Okay.
How much are you going to be able to tolerate? I don't know. We'll find
Okay.
out. We'll find out.
Okay.
And of course, we're not going to go hard and then just see what happens. We're going to work our way up. Like, we don't start with 100 pounds, we start with 5 pounds.
Mm-hmm.
And then work our way and see what we can do. I might do a few passes. Hey, let's go walk out there. Let's see. Let's get sit, stand, see if it makes it better. And kind of, we don't just guess. We kind of, like, go through a process.
Okay.
I do think that as a result, you're losing some hip flexion, which I think will be easy to get back.
Okay.
You definitely don't stabilize as well on this right side, which is why like that straight leg raise on the left is problematic, because what happens, like when you did the left leg raise, the right side kind of went because you don't have as much strength through this like we call it posterior sling. You don't have that, like, and that's right through here, and you have the most amount of tenderness right through here.
Right.
Every time I touched a muscle, you were somewhat fine. Every time I touched a bone or a ligament, we're not fine.
Okay.
Everything leads me to believe that this whole amount of ligament involvement has just been neglected. And so I think that's something we need to work on significantly. Any questions on any of that?
How do I work on it? How do I fix it?
So I'm gonna give you some other stuff. I'm gonna work on some of the ligaments, and then I'm gonna retest you. Because when I retest you, if you get better, in theory, almost instantaneously, not to say that you're gonna stay better instantaneously, but like if you get better, that gives me a process of like, hey, I think, like I kind of take it from like a scientific level, like, hey, if problem A is here and we apply a problem B or solution B to problem A and that works, then I can give you some exercises to help that equation. If we think it's problem A and then problem B or solution B doesn't show viable, we have a few questions to ask. Are you not responsive to treatment? Is it not really problem A? Is it problem Z? Or you know what I mean? Is it the wrong solution? Is it the wrong exercises? Like what is it? And like for me to repeat the same things, we can actually kind of filter through that a little bit faster.
Okay.
So what I want to ask is during your testing or assessment or in personal life, what's the worst thing? Is it sit to stand?
Yes.
Okay.
Yeah, I would say so.
Okay.
Yeah.
So let's use some of that as our litmus tests. And so we know sitting, standing is like pretty uncomfortable for you. Which, by the way, when you do this, that's like the most strain on the ligaments
Okay.
and the pelvis, which
Right.
makes sense. Any questions for me?
I think